Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What are the heart disease risk factors for women? How are they different from men?
A woman, about 75% of the time when they're having a heart attack, they don't actually present with chest pain. So it can be very confusing for both the patients, the women themselves, and the doctors to figure out what's going on with them when they have a heart attack. So they might experience shortness of breath. They might experience heartburn-like symptoms, burning that can go into their jaw or to their back. They might experience nausea, vomiting, palpitations. So their symptoms aren't sort of the classic elephant-crushing chest pain. So oftentimes they don't realize they're having a heart attack and they wait too long before they seek treatment. And often even doctors sometimes miss the signs and don't get an EKG, which is usually how we diagnose a heart attack. It's a simple test where we just run a strip of paper and can see what's going on with the electrical activity of the heart.
When do symptoms necessitate a call to 911?
If you're ever having symptoms that come on and they don't go away and don't resolve, that's a sign that something serious is going on. So if you have nausea, vomiting, shortness of breath, dizziness, lightheadedness, I would err on the side of caution and call 911. Don't drive yourself to the hospital because when you're having a heart attack, time is muscle. So the sooner you're seen and the blockage is opened, the better the outcomes are. And we found in many studies that women wait far too long before seeking treatment, and they actually have far worse outcomes than men in a lot of these situations because time is muscle. So the longer you wait, the longer there's no blood flow to the heart, the worse the outcomes are. The only thing I would recommend is if they have an aspirin at home, chew it. That can decrease their mortality from dying from a heart attack. And don't drive themselves to the ER. They should call 911.
What are ways to prevent heart disease?
It's very important for people to go to their primary care doctors regularly, have their blood pressure checked, have their cholesterol checked, to sort of know their family history and risk for having an event in the future. It's important if they're a smoker to quit smoking. Studies have shown that plaque actually regresses in the arteries after people quit smoking. And it's very important to stay active. So there's been studies that show, even overweight people who are active and not couch potatoes have less of a risk of dying from heart disease than overweight couch potatoes. So being active is very important, and paying attention to the body mass index, which is essentially looking at your weight related to your height, and having that in a good reference is really important.
How can women access the Women's Heart Clinic at UMass Memorial Medical Center?
There's a Women's Heart Health Clinic that I run, and I personally see every person who comes to the clinic, and I assess their risk factors for heart disease. And being a cardiologist, sometimes I'm a little more aggressive at starting people, for example, who have a very strong family history on a statin than maybe their primary care doctor would. So I can always give them sort of an independent assessment of their risk factors for heart disease. And we can also offer nutritional support and counseling. We also have tobacco cessation counselors who can help them if they're smokers and they're having trouble quitting. So it's sort of a multidisciplinary approach to trying to optimize their treatment.